Hello again, everyone. My name is Marty Guthmiller, and I am the CEO at Orange City Area Health System, bringing you today the 52nd edition of our COVID-19 community briefings. The 51st edition was done on Monday, August 31. So when I reference last time, that is 3-4 days ago, depending on how you count that, Monday. I'm going to speak today, first of all, and change the order of how we present some statistics today, focus on Sioux County, because clearly the numbers are up. So let's jump right into Sioux County stats. We have 919 positives, nearly 1,000 now, 919. That's up 24 since Monday. So it's 919 of 5,644 tested. That's a positivity rate of 16.3%. So comparatively, again, the last time we talked, 16.1, time before that, 15.9, time before that, 15.1, and then 14.3. So clearly trending up. There's no question about that. I'm very aware that, from time tested or from positivity confirmation to illness can be delayed sometimes. I mean, I clearly understand that. And so what I did, I actually went back to a previous briefing, and it happened to be that we did the 44th edition on August 3, so exactly a month ago. And I looked at some of the stats then, and the positivity rate in Sioux County then was 14.6, so still pretty high, and really not that far off from where we are today and where we've been at 14.3, 15.1, 15.9, and today 16.3. And so what has happened over that last month from August 3 till today has not reflected higher acuity levels. Again, during those times, it's the 1Z, 2Z kind of thing in terms of hospitalizations, oftentimes zero in Sioux County. And so that really hasn't changed. And so while the positivity rate is higher, we are having more positives, by and large, with some exceptions, I'll talk about that. By and large, it's been relatively high in that 15% mark for a number of weeks now. So it's not necessarily a newer phenomena, although it is maybe an accentuated one. I also think it's important that we look at who is being infected. Where are these positives coming from a demographic, particularly an age demographic? And 48% of the Sioux County positives are in the age category of 18 to 40. The reason I say that is that's a good thing, in part because typically that's an age group that can stave off this virus and might account for some of the lower acuity levels. When you take a look at the under 60, 61 and over is the biggest demographic when you get to deaths and things like that. But when you get under 60 in Sioux County, 83% of our positives in Sioux County are 60 or under. So again, good news, and maybe part of this discrepancy that we're seeing from the really spiking number of positives to not so much so in the hospitalization category. I'm going to go right into the percent positive 14-day average right now because Sioux County is not doing great in that area either. Sioux County today is number 4 in the state in terms of the higher positivity rate at 21.8%. When we talked on Monday, it was 21.4. So we're heading in the wrong direction. But again, Plymouth County is ahead of us at number 3 at 22%. Number 1 in the county or in the state is Johnson County at 24.4%. I'll talk a little bit about Johnson County hospitalizations too in just a minute, just as a comparative. On Monday, I mentioned that there are 34 counties in the state at 10% or higher in terms of the 14-day average. So today, because statistics are only good when you can compare them to each other and see trends and what's happening. So that number today is 32. So a little bit of a good thing there in that we've reduced the number of counties in the state at a 10% or a higher level. Again, we'll take any wins, and so that's at least heading in the right direction. Region 3, in terms of heading in the right direction, is not. Region 3 has 44 hospitalized patients in the 20 county area. That number is up from 30 on Monday. We had 12 patients admitted over the last 24 hours. So a lot have been admitted very recently. There are 7 in the ICU, and that number previously was 4. Iowa has 65,155 positives, over 635,000 tested at a 10.3% positivity rate. Interestingly, I looked at, I'm kind of on an age demographic thing today, and so I looked at that, and 84% of Iowa's positives, so 84% of the 65,155 are 60 and under. So again, by far the majority of our population is not in the what we consider vulnerable population. So that's a good thing. Hospitalizations, I wasn't able to bring you that on Monday because I had issues with my computer. I've figured out how to get around the block on that, and so I got to it today. The number that I would have reported on Monday is 290 hospitalizations in the state. Today the number is virtually the same at 289. So we have 289. One of the things that we're looking at, and I want to explain, Sioux County has 6 patients currently. I'm trying to look into a little bit more on that. My understanding is that that is the number of patients hospitalized in Sioux County hospitals. And I'm going with that until somebody proves to me that it's different. But we're actually trying to get that answer from the state, and I'm doing a little informal survey today as well. But because that number seems like a high number based on what we are seeing here from an acuity standpoint. I'll get back to you on that, and I will follow up. Plymouth County has 5 patients, O'Brien County 2, Lyon County 0, Woodbury County 13, and Polk County has 57. And Polk is down from 65 on Monday. I mentioned that Johnson County is number 1 in the state relative to 14-day percent positive at 24%. I was curious what was happening with their hospitalizations in Johnson County, and they are at 7 in Johnson County and a far eastern part of the state. And that number on Monday was 14. So they're the number 1 in terms of positivity rate over the last 14 days, and their hospitalization dropped from 14 to 7. So again, I haven't done a lot of checking in terms of the history of percent positives in Johnson County, but looks somewhat similar to what we've been experiencing. I'll close on the statistics with just mentioning the deaths. We have had 22 more deaths this week at 11:34. One thing that, following on my age demographic thing today, there has been no significant change in that at all. 89%, nearly 90% of all deaths are in the age group of 61 and over. And again, 0% have been from 0 to 17. So nothing is changing in that. Unfortunately, we're still experiencing deaths in the state. But in terms of the demographic, that's pretty consistent. I'm going to finish up today on just a recount of Dr. DJ Donlan's acronym. Instead of Orange City Area Health System, he uses OCAHS with the following words. O stands for observation. And again, that's kind of what we choose to see, we often see. And so that has to deal with your perspective a little bit. And this acronym is to how we can cope and deal with the COVID situation, which admittedly is a burden that is becoming a collective burden that is manifesting itself in many different ways with many different people. So O, observation. C, connectedness, that humans are meant to be connected and that we need to choose to intentionally connect with those things in our life that's important. Faith, family, outdoors, whatever it is, connect with those things. Adaptability, we need to flex, and of course, everybody knows that by now. H is health, that's keeping the engine tuned, and the S for today stands for showing. And when I went back and looked at the video, Dr. Donlin was talking about showing as opposed to not just talking. And when you look at how children learn the best, it's often from watching their parents. And whether you're talking about colleagues or members at work or people in the grocery store that you run into, in any connection that you have, demonstrating and modeling. In this case, what I'm referring to is the social distancing measures and masking measures, that when you model that, when you demonstrate that, people are watching, people learn, and people learn from the modeling is what I'm trying to say. And that's what Dr. Donlin was talking about. I guess walk the talk is another way to look at it, but S stands for showing. So observation, connectedness, adaptability, health, and showing. I may come back to that at some point too. So hopefully that helps a little bit. Try to remember to control what you can control. I will come back probably on Tuesday, with Monday being a holiday, and give you the next update. So if you're interested, you can look for that. I will plan on Tuesday at this point. And in the meantime, have a great Labor Day weekend. Use some common sense out there. Have a good time, but keep your social distancing, stay vigilant, and stay strong and stay healthy. Thank you for joining us today.